training today at the Card Center. Today we're going to have Jenny Sharpless here. She's one of our speech language pathologists who's been here for many years. She's going to be talking to you about the importance of joint attention. So if everyone wouldn't mind turning off their cell phones and completing the surveys, giving them to me at the end of the presentation, we can go ahead and get started. Jenny?
Thank you all for coming. We have a nice big group. And it's exciting to be able to share some treatment strategies and information about joint attention with you today. We're going to talk about joint attention. We're going to talk about why it's important, certain developmental milestones for children, and then treatment strategies, how to enhance joint attention in children. We have some video examples at the end. And then there will hopefully be time for questions as well. All right. Joint attention is one of those buzzwords that whenever I use the term, I always want to make sure people know what the word means. Sometimes I come across people who are very familiar with the term or not familiar with the term, and I like to explain to families that I work with and other professionals who I do trainings with exactly what we mean when we use the term joint attention. Joint attention is when two people share attention between each other and an object or an event. Today we're going to talk mainly about initiating joint attention and responding to joint attention. So for initiating joint attention, what we're going to talk about is how someone might direct another person's attention towards something that they're interested in. And then response to joint attention would be how you respond when someone else wants to direct your attention. Stacey, is it okay if I'm not using the microphone, or am I supposed to use?
No, you're perfectly fine. I'm very comfortable with.
I don't like using microphones. And so I'll use the term IJA and RJA today to explain both of those terms with you. So joint attention, how can a child or a person initiate joint attention with others? What I'm going to do is demonstrate a few things with you. I don't have specific video clips for this part. We'll look at those at the end. But for joint attention, if I wanted to show you all something in the back of the room, all I have to do is point back there and say, look, and you all would turn around and look to the back. So if you all look, there are some snacks and handouts in the back if you are interested. One day I was here in this room doing or listening to a talk, and whoever was presenting was like, oh my goodness. And everybody in the whole place looked out the window, and it didn't take anything but someone shifting their gaze and their eyes outside. And there was some sort of animal in the parking lot, like a deer or a coyote or something, that everyone looked at. Some of you probably remember that day. So I can direct your attention to something of interest, to the things in the back in case you were interested in taking some snacks or some handouts, or if there was something really interesting for you all to see, you'd only need to look at my face, the orientation of my eyes, to see what I'm looking at. I can also do some other things to show things to you, to direct your attention. I could give you something. I could show you something by holding it up. Those are ways that I can direct your attention. And also using my words, directing you by saying look, or by talking about what I am looking at. So now that you know what it is that we're talking about today, why is this so important? Why even talk about joint attention? There are many reasons. Joint attention plays a critical role in engaging in shared experiences. And the reason why this is so important is that's how you can learn from me, by understanding where my interest and my attention is. You can learn from me. If I am talking to you and I look over at my PowerPoint presentation and look back to all of you, you're also going to look over at my PowerPoint presentation. You're going to listen to what I'm saying. You're going to understand how it's related to what I'm looking at. And this is what we see is important in children's development. If we look down here at the bottom, It's a pivotal behavior. That means that improving joint attention or having good joint attention is going to help in many other areas of development. I like to think of a wagon wheel, and the center of the wheel is joint attention. Then all the spokes of the wheel are all the other forms of development that joint attention enhances, such as play, language, social development, cognitive development. Because if you're attending to another person, you're attending to what they're doing, you're attending to what they're saying, you're going to learn to understand their words, you're going to learn how to do what they're showing you to do. You can learn many different things from another person. But if you were playing words with friends out there in the audience, or texting, or preparing for whatever you're going to do later in the day, you're not attending to me, you're not attending to what I'm looking at and what I'm saying, you're not absorbing anything from what I'm saying. So at the end of the presentation, you'll think, oh, now what was she saying? Because you didn't actually have this joint attention with me, looking at looking at what I'm looking at, and listening to what I'm saying. And this impaired joint attention, this inability to attend, isn't just seen in your playing with your iPhones today. It's seen in kids who have autism spectrum disorders. We see that children with ASD have impaired IJA and RJA. So what we were talking about first was RJA. You're attending to me, attending to what I'm looking at and what I'm talking about. If a child's not attending to you and what you're saying and what you're doing, that's seen in children, that impairment is seen in children with autism. But also we see an inability to get your attention to show you things that they're interested in, that they want you to see, that they want to share that experience with you. So we see both of those impairments in development of children with autism. And this is an interesting thing to think about as well. In children, in older children with autism, we talk about the topic of theory of mind, being that a child understands what someone else is going through. Someone might have empathy for another person, be able to put themselves in someone else's shoes to see what that other person is feeling or thinking. This is something we see in children with autism. They have a hard time with this idea of theory of mind. And in my review of the literature, I found information about how these early impairments in joint attention are later, or can be related later to these impairments in theory of mind. If you don't look when I say, oh, to see what I'm looking at outside, then you aren't understanding that I must see something very interesting, understanding that I think something's interesting. So you're going to look, because you might be interested too. If that early joint attention, being able to see what I'm seeing and understand that I'm interested, if that is impaired, then later on, if you see that I'm experiencing sadness, or if I fall and scrape my knee, or if I have some other thing happen, you'll have a harder time being able to empathize with that because of these early impairments in joint attention. So I found that was very interesting as well. So these early impairments in joint attention, if they lead to these impairments in later theory of mind, then a theory might be, well, if you attack this impairment in joint attention early, are you helping that later development of theory of mind? All right. I'm going to talk now about typical development of joint attention and what we see in very early development of infants. RJA, that response to joint attention, you seeing what I look at or seeing what I'm pointing at, that starts in infancy really develops and becomes solid between the ages of 9 to 12 months of age. That would be if a mom is feeding her baby in the high chair and looks over at something across the room, the baby can look over too and see what mom is looking at. That's something that starts out early in infancy. But then at 12 to 14 months of age, the baby then looks back at the mom to check back in, to show, oh, I just saw what you saw. So first we have that response by looking and that checking back in with mom to see, okay, why was that important? Then for IJA, children start to develop some gaze shifting, looking between objects and people, 6 to 9 months of age. But at that age, it's not done in a communicative way. It's not done to say, hey, look at that. It's just that sharing of attention, looking from what I'm doing over to mom or another adult and back to the object. But then at 9 to 12 months of age, that's when the baby becomes more deliberate, shifting their gaze in more of a communicative manner, as if to say, look at that, or starting to gesture using a point, using a reach, or using some vocalizations to share that attention. And usually, this whole process of joint attention, from responding and initiating and shifting the gaze back and forth, is usually solid between 14 to 18 months of age. So around that time, around that 18-month mark, 2-year mark, might be around the time when families start to notice some concerns about their child's development. And this is one of those things that they might notice is, I'm not getting that directing my attention. I can't direct their attention. It's one of those early signs that families do see if they're having concerns about autism. Children use this joint attention behavior for learning. There was a study done that looking at how children best learn language. And it's really through joint attention that children are learning language. If I am working with a young child or playing with a young child and I say a word that they've never heard before, what you see in typical development is that a child will look from what I am looking, from me to what I am looking at back to me in order to learn from me what this new word is or what this new object is. If I'm playing with a dump truck, and I'm pushing a dump truck and I say dump truck and the child thinks dump truck, I've never heard that word before. The instinct is, look at me, look at what I'm doing. That is seen in the research that I reviewed. It's seen in the child's 2nd year of life, so 12 months to 24 months. Children are using joint attention for learning language. And like I said, when you think of that wagon wheel and the cog of the wheel is joint attention, and you can think, well, they're not just learning the name of that object, they're watching to see what I'm doing with it, they're problem solving, how they might use it, so a lot happens in that moment of joint attention. I'm going to talk about joint attention versus requesting, because I want you to think about joint attention in separately from the behaviors a child might use in order to get what they want. Because there's a difference between these two things I want to talk about. A child may also point, shift their gaze, use other gestures or words to get your attention on something, but it might be something that they want. So their snack is on the top of the refrigerator, their favorite toy is where they can't reach it, so they might get and direct your attention for the purpose of, I want that object. What we're talking about today with joint attention is a little bit different. I want you to think about joint attention being more of showing you something that's interesting, getting your attention for a social benefit or reward, not to get needs met. So in thinking about requesting, you might see pointing, gaze shifting for the purpose of requesting. But today, the purpose of the behaviors we're going to talk about today are for sharing attention for the purposes of social engagement and social motivation. And it could be something tangible, but really you want to think about it differently from requesting. So we talked a little bit about this already, how we see deficits in joint attention in autism, and how it can suggest a lack of more social motivation, especially if you see all of these behaviors to get needs met, but you don't see these joint attention behaviors just for social engagement, playing, getting attention to share, and to show. And if we talk about how research is showing that joint attention, these joint attention behaviors leads to language learning, then we can suspect that that language delays can be explained by some of this limited joint attention. All right. So because joint attention can be found as a predictor of language, and because social and language development are areas of deficit for kids with autism, then it's important to think about working on joint attention at home, if you're a parent, in a therapy program, if you're a therapist, or in school, if you're a teacher. And the idea is that social, language, play, cognitive development, other areas of development can all be indirectly enhanced by just targeting this one skill. And in an earlier slide, we talked about how that is called a pivotal behavior, when you can change one skill or one area of development and it enhances a whole host of other areas of development. That is considered a pivotal behavior. So you get more bang for your buck. We're going to talk about strategies now. Before we talk about strategies, we are doing well on time, so I thought I would see if anybody has any questions so far about what is joint attention or some of the developmental areas.
I have a fundamental question and objection. Because your wonderful PowerPoint is distracting me. Because I want to have joint attention only with you and not to share my mental abilities of reading and hearing you, and because we learn through mirror cells. That means eye-to-eye contact. I wanted not to have the PowerPoint, believe me, and I am a professor and I use PowerPoint, unfortunately. The students want them. I wanted to have the notes to read afterwards and listen to you, hearing you, and eye-to-eye contact with you. And that is the normal way that human beings are learning. Believe me. Just now, my son, who has also, he's just in the back, he's taking an intensive, he takes an intensive course of speech and communication at Autism University. Wonderful course. And because of his speech, yes, because of his speech problem, he is limited in 4 minutes presentation. We asked the professor if he could do PowerPoint presentation instead of speech, because the course is speech, no PowerPoint presentation. And she said, okay, just only if the PowerPoint is not taking the attention of the students, like the focus must be you and not the PowerPoint. And before giving him the permission, she has to check the PowerPoint to see if it is distracting. So that's my point that I would like to make. And we have to look again on the new technologies, how they...
Absolutely. And that brings up a good point just about technologies, but yeah. I think in thinking about making sure that I am having considerations for different learning styles as well is important, because we've got, if I went around the room and asked, how do you prefer to learn? Some people will say, I just want to sit and watch you and hear you talk. Other people are like, I have to read it. Other people might say, I want you to show it to me. So in thinking about that, I agree with what you're saying, but I think it's also helpful to make sure everybody's learning considerations are taken into consideration too. Because someone might not want to look at me; they might just want to read what's on the screen, and you know, we can, you know, probably, you know, argue this
On
also.
top, at Johns Hopkins, a recent study, very good study, showed that people having two stimuli at the same time
Mhm.
learn and understand less than people having just one stimulus.
Mhm.
A wonderful experiment.
Yeah, it's
Which
very interesting.
brings major changes in
Yeah.
our way.
Yeah, it does. It does. Thank you. Any other comments or questions? So we're going to talk now about strategies. The number one thing that we need in order to target joint attention is something motivating. Because I'm not going to point out something not interesting to you all. I wouldn't say, everyone, look over at the exit sign over there. It's not even on. I mean, there's no point. It's not interesting. It's not motivating. I'm not going to do it just to see if you all can respond to my point. But if, in the examples I gave before, if there was a purpose to why I wanted to direct your attention, I thought you would find it interesting. That's what we want to think about. And if we're targeting joint attention as a strategy with children with autism spectrum disorders, we want to make sure whatever we're doing is motivating, interesting, relevant, and that's really important. But also, it could be something new and that we know might interest a child, something novel, or it could be something that we know the child likes. It's already a preferred activity or object. These are some suggestions for working on RJA. So trying to help our child respond when we are directing their attention. And some of them are very easy, things that we already do with young children, but it's nice to know that some of these very simple things are what's needed to help a child learn joint attention skills. Just talking about what your child is doing and what your child is looking at. Because we know joint attention, in those moments of joint attention, the child is best able to learn language. That's important to really think about. So I like to think of it as the brain being a sponge. The way I like to explain it is, in a moment of joint attention, the brain is like a dry sponge, ready to soak up everything you're saying or doing. But if the child is not attending to you and not learning from you and maybe doing their own thing with a toy or engaging in their own activity, then their brain is more of a wet sponge. It's harder to soak up what you're saying and doing if their attention's on something else. So I like to think of those moments of joint attention being that dry sponge, just ready to soak it up. So we have to make sure we capitalize on that by showing interest in what the child has and what they're doing, talking about what they have and what they're doing, or showing them something new or something to do with the object. I like to use a lot of joint attention behaviors when working with a child. If the child's playing with a toy, I like to point at it and just model those joint attention behaviors. You can point to things that are close and touch it. You can point to things that are far away that they can't touch. But with a child who does have impaired response to joint attention skills, pointing to something very far off might not be the place to start. It's harder to point at something that is a moving target, like a squirrel or a dog or a helicopter. It's a lot easier to point to something in the environment and something that, if the child does not respond, you can get closer to it and point to direct that behavior. So that's one of the strategies to use. If I was talking about, say, the PowerPoint, and I pointed over to it, and I noticed that you're still not looking at it, I just might walk closer and point to it to help direct that attention. It helps to teach a child that the pointing gesture is important and to attend to that, that gesture. Also, I try to point to things in a child's natural environment that's just part of the day-to-day activities. So if you're taking a bath, it's time to get out of the bath, you need to get your towel, and point to it. Oh, it's time to get a snack, let's get your milk out of the refrigerator and go and get it. So the pointing is a precursor to the next behavior that you have, to just bring attention to that that's an important gesture and that something is interesting on the other end of that point. Like I said earlier, always keeping it relevant, not pointing for the purpose of pointing things, but thinking about how to keep it relevant, interesting, meaningful in the child's environment. I like to use a game with a puzzle or other type of toy with pieces. And I meant to bring it today, but I forgot to leave myself a note about that, so I forgot to bring it. But the way that I use a puzzle or a shape sorter or other toy with pieces to work on a joint attention behavior might be to play with that toy, but hide one piece off to the side where the child does not see it originally. So you're playing with the puzzle, and after you've put all the pieces in, there's one missing piece. It creates a really nice opportunity to direct the child's attention, like, oh, missing it. And then direct the attention by pointing, oh, look over there. And if they see it, they can get it and continue the puzzle. If they don't see it, it can be close enough that you can point closer and touch it, or even tap it to direct the attention. If this is something that the child is responding to, you can get really creative and start hiding some different pieces around the room and turn it into a hiding and finding game. And what this does is it just shows the importance of what your pointing gesture is. It's showing them something. And you can do repeated practice. So say you have half the puzzle pieces and then half of them are off to the side. It's repeated opportunities to practice responding to a point in a motivating activity that is using something that they're interested in. Once a child's good at following a point, you might want to start pointing with your eyes to show the child that it's not just your pointer finger that is directing their attention, but the orientation of your face and where your eyes are pointing is also an important cue as well. So after a while you can say, look, and just give a very deliberate turn of the face and head and use your eyes to look at it. If that is something that is still hard for your child, after you've provided that cue, you can go back to pointing with your finger. Our activities used to help a child respond to joint attention, but any time you do an RJA activity, you're teaching the skills that you want them to have for later IJA. So it all is related. And with strategies for IJA, what we want to do is we want to provide a lot of social motivation for the child when they look at you. So when they're playing, if they look at you, provide that social motivation, talk about what you're playing with, smile, give the type of reinforcement so they want to look to you again when they are playing. If they notice that you're excited about what they're doing, you might start getting some of those joint attention behaviors, showing things to you, directing your attention, wanting you to be a part of their play. I also like to imitate the child for a whole host of different reasons. Imitating your child is a really good strategy, but another benefit of it is that it creates an opportunity for them to want to share an experience with you as well and start working on that. Wanting to get your attention by doing an action with a toy because they know that you will imitate them. So they can use that as a way to get your attention and to direct it to what they're doing. But also, creating surprises in the environment can also tempt a child to want to get your attention. I might have some video clips that show that as well. But any types of activities that can promote showing, pointing, giving type behaviors are going to enhance a child's IJA.